Hello, this is Dr. Carlo Oyer, emergency physician and founder of PatientEducation.Video.com, a website that provides free patient medical education videos related to emergency room diagnosis. In this video, we're going to talk about bronchitis. Bronchitis is an inflammation of the inside surface of your bronchial tubes, which carry air to and from your lungs. Usually results from an URI, upper respiratory infection, that somehow makes it deeper into the respiratory tract, causes inflammation, swelling, and mucus production of the bronchioles. People who have bronchitis often cough up thickened mucus, which can be discolored. Bronchitis may be either acute or chronic. Chronic bronchitis, a more serious condition, is a constant irritation or inflammation of the lining of the bronchial tubes, often due to smoking. The damage is caused by cigarette smoking, inhaling toxins or other irritants. Genetic predisposition can make a person's lung more susceptible to damage from smoke and pollutants. Alpha-1 antitrypsin deficiency. Gastric reflux. Repeat bouts of severe heartburn can irritate the throat and therefore irritate going down the airway and also cause chronic bronchitis. Most cases of acute bronchitis are non-bacterial, like common respiratory viruses, but also things that irritate the respiratory tract, like chemical and fume exposures. By looking on the graph on the left, you'll see that 90% or more are viral, and they don't need antibiotic treatment. Some are non-infectious at all, and those are from chemicals and fumes, and then 5 to maybe 10% are bacterial. Acute bronchitis usually improves within a few days without any lasting effects, although you may continue to cough for weeks. If you have acute bronchitis, you have a nagging cough that lingers for several weeks after the inflammation resolves. Chronic bronchitis is defined as a productive cough that lasts at least 3 months, with recurring bouts occurring for at least 2 consecutive years. Symptoms: cough, the production of mucus or sputum, which can be clear, white, yellowish, gray, or green in color. Rarely it may be streaked with blood. The color of the sputum does not correlate with the cause of the inflammation. That is, it doesn't predict if it's viral or bacterial. Also fatigue, shortness of breath, slight fever and chills, and chest discomfort. Let's talk about the tests and diagnosis. A chest x-ray. A chest x-ray can help determine if you have pneumonia or another condition that might explain your cough. This is especially important if you ever were or currently are a smoker. Sputum tests. Sputum is the mucus that you cough up from your lungs. It can be tested to see if you have whooping cough like pertussis or other illnesses that could be helped by antibiotics. Sputum can also be tested for signs of allergies. Pulmonary function test. During a pulmonary function test, you blow into a device called a spirometer, which measures how much air your lungs can hold and how quickly you can get it out of your lungs. This test checks for signs of asthma or emphysema. Let's talk about the medications. Antibiotics. Bronchitis usually results from viral infection. We said more than 90% are viral, so antibiotics aren't effective. However, your doctor might prescribe an antibiotic if he or she suspects that it is due to a bacterial infection. Cough medicine. It's best not to suppress a cough that brings up mucus, because coughing helps remove the irritants from your lungs and air passages. If your cough keeps you from sleeping, you might try cough suppressants at bedtime. Inhalers. There are many different kinds of MDIs, metered-dose inhalers. The main therapy is bronchodilators, shown on the top. These open up the tubes of the airway. Then there are inhaled anti-inflammatories, which work on the inflammation cascade to stop the airway from swelling and producing mucus. When you use MDIs, make sure you use a spacer, a plastic chamber that attaches to the inhaler. This allows the medicine to be aerolized properly so that the medication can make it all the way down to your lungs. It is common for the symptoms to linger for days or even weeks after successful recovery from bronchitis. Your airways will be hypersensitive to irritants, and you might get tight and short of breath from very little stimuli. However, if you are actually getting worse, if you develop a fever, if you are getting sicker in any way, you must return to the emergency room for re-evaluation. Follow up, follow up, follow up. Always follow up with your primary care provider. He or she will make sure that you are healing as expected, that you're not developing any complications, and they can consult the appropriate specialist if necessary. For other videos like this video, please visit www.edxitvideo.com. But remember, these are educational videos and should never replace the care or attention of a medical healthcare professional.